Welcome to the Greater Grand Traverse Area Continuum of Care, or COC, for this local collaborative of member agencies that serve individuals and families facing homelessness in Antrim, Benzie, Grand Traverse, Kalkaska, and Leelanau counties. The COC addresses housing issues through a community-based process which develops a comprehensive, coordinated continuum of care to address the shelter, support service, and housing needs of individuals and families who are homeless or at risk of becoming homeless in our 5-county area. In addition, the existence of this collaborative body allows member agencies to receive over $1 million annually for prevention, street outreach, shelter, housing, and support services from the U.S. Department of Housing and Urban Development, HUD, and the Michigan Housing Development Authority, or MISHDA, that would not be available without the COC. Implementing a housing-first approach, member agencies provide services in an effort to help people obtain and maintain permanent housing. COC member agencies believe that having a safe, permanent home is a basic human right. The vision of our COC is to end homelessness in the Greater Grand Traverse region. Let's take a look at some of the programs that are available through the COC member agencies in the areas of prevention, shelter, transitional housing, permanent supportive housing, and independent living, and how those programs are changing people's lives.
To be homeless, it felt very embarrassing. You know, when I thought of homelessness, I thought of lazy, I thought of dirty, I thought of people who didn't apply themselves. And when I learned that I was going to be homeless after leaving the monastery, I kind of felt like that I didn't want people to think the way that I thought of them. It was a very humbling experience because homelessness is totally not what you think it is. You know, a lot of us tried looking for work.
I was in a horrible relationship. He was just really unhealthy for me and my daughter. When it got to the point that I knew it was affecting her is when I realized that I had to do something. So we decided to come up north, back to Michigan, to my family, and we came here and had nothing and no one.
Unfortunately, I had to experience homelessness a couple times throughout my life. Wasn't going to stop looking, even though I knew the chances might not be all that great for me to find a place on my own. I still had to try, you know. You can't just not try and expect to be helped.
Northwest Michigan Community Action Agency is considered the HARA for the Greater Grand Traverse Continuum of Care. What that means is that we're the housing, assessment, and resource agency, or the single point of entry for anyone that's at risk of homelessness or is currently homeless in the Greater Grand Traverse area. We work with clients that may call us who are at risk of homelessness directly through our agency that may have gotten a 7-day notice, an eviction notice, or just know that they're going to have trouble next month paying their rent. Once they've gone through an intake with our agency, where they sit down with a case manager and we talk about their budget, we look at their budget, we may refer them to a budget class, help them to figure out how to get back on track, whether to pay for it. We may negotiate with their landlord and themselves on how to institute a payment plan, on working with getting that arrearage up to date so that they can eliminate that looming forebodings of a eviction from their daily life.
Next step is basically for us is the Goodwill Inn. And the Goodwill Inn is an emergency shelter. It's also transitional housing, but it's much different than like a safe harbor. So when we have people who are experiencing homeless come to the inn, we do an intake, we do an assessment with the individuals, and then we'll start connecting them with case management. So our case managers will meet with people who stay here and develop a plan. So, what were the circumstances that got them to the point that they're now experiencing homelessness? And then they will continue to work with that person as long as they're here and try and work through that plan. And they're basically, they're welcome here. We want this to feel like a home. We also refer people to all kinds of other agencies. So we pretty much have an open door between us and Women's Resource Center.
I don't think anyone will really understand how important it is to have a stable home until you've experienced not having that. I don't know if I can convey how important it is to know that you have somewhere to go home at night to lay your head down. It gives me a sense of hope to know that I have somewhere where I belong. I mean, when you're homeless, you're living in a bedroom with 6, 7, 8 other women. I mean, and you don't know. I just felt like I needed to become independent and more mature, and I needed to do this on my own. And so I entered the homeless shelter here in Traverse City, and I mean, I was terrified. It was kind of scary at first. I didn't know what to expect. I didn't want people to think ill of me because I'm a hard worker. The stigma of what people thought homelessness would be to just envelop me and just overcome me. So being in the homeless shelter was probably one of the greatest experiences I've ever had. It taught me like a real sense of humility. It taught me that I can do anything with God's grace. I met with Julie Olson, and she's in charge of the housing at the Goodwill Inn. And at that time, we went over kind of some of the things, the qualifications to some agencies, and because I suffer with severe depression, I qualified for what was known then as Foundation for Mental Health, which is now Northwestern Michigan Supportive Housing. We put in an application into there, and Emily, who was the new director at the time, pulled up my application, and she called me. I have an apartment available. Are you interested? And I'm like, yes. So that's kind of how I got my beautiful home here.
At the Women's Resource Center, we provide safe haven to women and children, families in crisis. And our services include emergency shelter. We have 1 emergency shelter and 22 beds available. We're answering the phone 24 hours a day, and so if a woman and her children are in crisis, we're able to take that call, and if they're fleeing a domestic violence situation, we can provide them with a safe place to be.
When clients come to us, a lot of them are in crisis and in need of emergency shelter, or a lot of them are in need of housing in general. So they may be leaving an abusive relationship, or they may have left an abusive relationship, and because of lack of employment, lack of financial stability, may not be able to find housing on their own. A lot of times our clients will move into one of our transitional homes, stay there for a period of time, and then take the next step and move into their own place using our voucher. So with our voucher program, we'll subsidize their rent. They'll pay about 30% of their income, and then we subsidize the rent. And a lot of them qualify for a utility reimbursement too, so that we can help them. The goal of the program is to help them for 2 years so that by the end, they're financially stable enough and independent enough to continue on with sustainable housing on their own. Throughout the 2 years that they're on our housing program, we encourage them to meet with an advocate at the Women's Resource Center to help set goals, to connect to different community resources, budgeting classes. A lot of them are going back to school. A lot of them are looking for sustainable employment. You know, one of the biggest problems in our area is finding affordable housing, and there are a lot of wait lists for a lot of the low-income or income-based rentals. So we encourage our clients to get on those wait lists when they start in on our program, so then by the time they leave our program, they may be able to move into an income-based or low-income apartment.
When I got there, they set up these goals, and you sit down with your, which ours was Cassidy, who's awesome, and You sit down every month and talk to her, and this is your plan for the month, and this is what you need to get done this month. And every month you accomplish this step and this step. It's all about doing steps to move forward, you know, putting money away, saving the money. Your rent is cheaper there, so you are able to put money back. They also show you all the places where you can enroll for rent that's cheaper for single parents and housing units and things like that. And every month you just make one step after another, like getting a job. It was a way of making me independent, to make me a real mother, a human being. They gave me hope, and they gave me my future, and they gave me the opportunity to get it back. So I couldn't have, I don't think I would have made it without them.
Northwest Michigan Supportive Housing is a small nonprofit in the 5-county area, and our mission is to provide permanent supportive housing to homeless individuals and families with severe mental health needs. We currently have 80 households in our program, so with spouses and children included in that count, we're responsible for housing anywhere between 130 and 140 individuals at a time. Our wait list currently numbers over 300 households waiting. Our program, we do two things. We provide leasing dollars, so that's actual money to help folks with their rent, but we also provide supportive services like budget counseling, home maintenance, self-care, clinical supportive services, that kind of thing. And the goal of pairing those two things together is that eventually people will be able to achieve independent living. And so that's really what we want of our tenants and their families, is to be able to live independently and gain the skills in our program to do that.
I wouldn't be here. I would not. I'd probably, to be honest with you, I would either still be in a homeless shelter or on the streets or probably in jail. One of those three, more than likely, or staying at a friend's that is dangerous to stay at, or it would probably have been not a good situation for me, a living situation or otherwise. That constant worry of where am I going to be, where I'm going to stay, what am I going to do? That causes you, well, it causes a person. I know it caused me a lot of stress, almost to the point where I wasn't able to recover from it. You know, it's a pretty stressful thing. Just such a wonderful feeling to have your own things in your own place.
The purpose of the Continuum of Care is to ensure that individuals and families have access to decent, affordable housing and support services designed to help them become integrated socially and economically into their communities. Along with providing housing solutions for those facing homelessness in our 5-county Continuum of Care, these housing solutions are also supported with wraparound services, such as help with finding income and employment, financial management skills, food and clothing, and sometimes mental health or substance abuse treatment through our many member organizations.
And the goal of all of it is to try and provide the best services we possibly can to the clients, and try and help them get out of homelessness. They're all our neighbors in one way or another, and trying to provide the wraparound and the services to help people move through the system.
I would really strongly suggest a good support system. Find those local agencies who are not only just there to kind of tell you where to go, but they're there to help you go where you need to go. They're standing right beside you, they're working with you. You're not alone in this journey. You have people who are there to help you and support you.
We could not do what we're doing today without the partnership that exists within the COC and the membership of the COC. I just want to say thank you to the other COC partners. It's been quite a journey, and the fact that we get to work together and help people who are facing homelessness and help them help provide shelter to them and housing to them and the services they need to become self-reliant and succeed is good work. So thanks to everybody who's a part of the COC.
We work together at monthly meetings and through committees such as Outcomes, Interagency Services Team, and Homeless Youth Initiatives that are targeted to specific needs or populations. We will continue to collaborate on a continuum of care and will eventually end homelessness in the Grand Traverse region, and we welcome your involvement.